What's up? It is Thursday, February 5th. I did not get to vlog yesterday. I started, and then it was just a crazy day. The day literally unfolds in such a crazy manner for me. And let's talk PTSD. So, I have experienced a lot of PTSD from cancer. And I'm gonna just close my office door. Yes, this is my office. It's not the best. It's technically not an office. It's my choral storage room where I keep all of my repertoire, music, past and present. I got music over there. We got a cabinet. I don't use that cabinet. Keyboard stuff because I also teach piano, sound equipment, a robe that's just hanging out, a Christmas tree that's just hanging out, printers that don't work, a bookshelf that is messy, pianos that need to be repaired, trophy that we got last year in May for choir, and then a bunch of supplies. Doesn't feel like an office, and my desk is like all like ripped and broken, but it's a space and I'm using it, okay? So let's talk PTSD. But before we talk about that, let's talk about how I have a bandana on, okay? I have a bandana because my hair is starting to get crazy and it is way too cold to be washing and going in the morning. So we have not been doing that. And so the bandana makes me look a little bit more human, okay? Okay, back to PTSD. So, you don't realize that you're experiencing PTSD until you experience PTSD. And I will say that I've had some issues in my life that have caused major stress to the point where if I hear certain sounds or open up certain emails or use certain apps, it kind of triggers me, if we could use that word. I think that word is so overused right now, but we'll just use it. What are some examples? I had a huge issue professionally in my previous school district. Won't go into details, but it was so traumatic to have high up district administrators requesting your bank accounts because parents claimed that I had stolen $7,000 from my band program, which was not the case. I had every receipt, every dollar to the penny was accounted for. So I was cleared of it, but it still left such a stain that till this day, and this happened over 12 years ago, till this day, if I still have to drive into that town, a part of me gets a little flustered. And so I'm still dealing with that. And then in 2020, my firstborn got sick. They said it was flu, I guess, but it was also COVID, but they weren't testing for COVID. Long story short, she almost died in February of 2020. And I still vividly remember the images of me holding on to her little ankle. She was 4. The doctor's hands shaking because they couldn't intubate her. I remember seeing her chest collapse because her lung collapsed. And I saw it with my very own eyes. And I was like, her lung just collapsed, her right lung. And they brought in an x-ray machine. And lo and behold, they did the x-ray. And exactly what I saw was correct. Her right lung collapsed. Her heart stopped. They're doing CPR on a 4-year-old. That messed me up. Till this day. So, I'm happy that I've gotten past that to an extent. Obviously not fully, if it still makes me cry. But when February would hit, February was tough because it was a month that I almost lost her. And for a while, Februarys were so difficult for me to stomach because I had lost my dog, my first dog ever, years prior. The same weekend that I lost my dog, Whitney Houston died. You're like, Whitney Houston? I loved Whitney Houston. And I was just like, oh my God, she's dead. And my dog died the same weekend. And then years fast forward, my daughter almost died. So February has been a tough month for me. But this month, I was able to get into February and not feel as stressed as I have in the past, which to me is a victory because I feel okay. Now with cancer, I started realizing that I was experiencing postpartum, you hear me? Post-traumatic stress disorder, PTSD, when I was done with chemo and I was slightly done with radiation and things started to get normal around September. I got back to work. And then I had to go back to the cancer center for a follow-up appointment, and just hearing certain sounds, the beeps, walking into the building, I did feel like, you know, like I'm here again, but I'm not doing chemo, but I'm here. I started noticing that. I do watch cancer, like survivor videos from like the patient story, and I started noticing every time I would watch the videos and I would see them accessing a port or see the machine where the IV and the chemos drip from, it would trigger me. Right after chemo, I knew for a fact that I would never drink anything red. And it has almost been a year from chemo, and I can't drink like fruit punch juices, anything that looks like that bright red 40 type color, you know? Kool-Aid. I can't do it because of the doxorubicin. Eating ices like limbe, like I don't know, you know those icy sticks that you could buy in like Walmart for like $1, $2? I cannot bring myself to eat those again and to feel that sweet crunch of ice in my mouth. Can't do it because it brings me back to chemo. And then my mom would make me juices while I was on chemo, and she would make me green juice and like pure carrot juice, and I didn't realize how sweet carrots were. And while I was on chemo, the carrot juice tasted so good to me. So good. I was like, and I would drink it all the time, and my mom would make more, and I was like, make me more carrot juice, and I would drink it. And then when I was done with chemo, my mom wouldn't make it as much, but she would, and she would give me a batch, and there were batches that I couldn't even look at it. And then I was like, oh, I don't want to waste this. So I would give it to my baby, and she would drink some of it, but I'm like, I got to drink some of it too. And I would drink a little bit, and the taste of it took me back to chemo, and I felt bad. I didn't know how to tell my mom, like, don't make it anymore. And then one day she made me a huge batch, and it was so big, and I just broke down crying, like, please, no more carrot juice. Like, I can't drink it anymore. And so I have been juicing recently, and I do still buy lots of carrots, and I've been juicing with carrots, but I haven't been doing pure carrot. I've been doing it with orange, with lemon, with ginger. And so the citrus, the acidity of, you know, the ginger, and it's knocking out that sweet carrot taste. So I'm still getting the benefits of the beta carotene and the mild sweetness of the carrot, but it's not like pure carrot, you know? So I'm tolerating that better. So I noticed I had PTSD with that. And at work yesterday, I got triggered. Like, I was pissed. I was like throwing F-bombs in my mind. You're like, what are F-bombs? You know what an F-bomb is. And so last February, like this time, I believe it was, one of our physical education teachers passed away from metastatic breast cancer. And I remember reading the email a year ago because I was getting ready to come back to work in February from my medical leave. And I saw the email that she had passed away, and I was like, oh my God. And I've got breast cancer now. I'm going in, and whatever, we got through it. But yesterday, they made an announcement honoring her, remembering her, and that they were in solidarity, gonna wear pink on Friday to remember her. And just hearing the words breast cancer and hearing the words pink and pink t-shirt and this and that for Friday, it pissed me off. I was like, come on, you know? And I was dropping F-bombs. I had to ask God for forgiveness, and he forgave me, but I still, whatever. So that's what we've been dealing with, and I'm trying to get myself ready for this surgery in April. I'm trying to get my mind ready for it. I'm trying to get my body ready for it. And during the day, I do really, really well. I've been eating great, doing the Weight Watchers app. But then I get home, and the stress of home does not feel like home to me. And it hasn't felt like home for a long time. Home is another job. And so walking into my house, I feel stress already. And then when it's nighttime, everybody's out. I need this. I'm hungry. I want that. Change my diaper. I'm hungry. Do homework with me. I don't want to do math. I hate subtraction. I hate multiplication. I don't want to do division. I hate school. I want to get out of school. I'm autistic. I want to jump around the house, and I don't want to sit down still. And it's just so much that I literally then just hide in my corner in the kitchen, and I start binge eating. And I'm like, all the great work you did today has gone down the drain. And yesterday my husband got some subs, and oh, no, I'm not going to eat it. I'm not going to eat it. Your girl ate a whole, foot long, with bacon and mayo. And so I just, it felt terrible. So we are trying our best. But yeah, I just wanted to bring that up about PTSD. And if you're going through this, if you're in survivor mode for cancer, how are you dealing with PTSD? Do you have PTSD? Did you have it? How did you get over it? What did you do? I would love to know. And I'm going to try my best to start getting on the treadmill every day, because that does help, the movement. And also just to help me bring some of this weight down so I can get into this reconstruction surgery correctly. So I guess that's today's video. I rambled enough for 13 minutes. See you next time.